It's true. Across the globe, women aren't as prosperous as men. Gender inequality is a pressing moral issue, but we forget it has massive economic implications. If you were to put all of the women who don't have access to formal financial services in one place, they would make up the third largest country in the world. That means an entire population without bank accounts, credit cards, or other tools you and I likely benefit from daily. Prosperity for women starts with inclusive policies, products, and people around the globe, and the investment to make it happen. Welcome to the Making Finance Work for Women podcast. My name is Sonia Kelly, and I lead Women's World Banking's proprietary research division. Join me as I speak with changemakers around the globe to deconstruct the social and economic exclusion women face. We'll discover new evidence together and drive action to accelerate women's economic empowerment. Because a leg up isn't a handout, it's a global game changer. Hello and welcome. Thank you so much for tuning in to the Making Finance Work for Women podcast, now streaming on YouTube and available wherever you get your podcasts. If you're listening on YouTube, you'll be able to find additional insights and resources linked in the description of the video below here. I'm the host of this show, Sonia Kelly, and I'm the global head of the Women's World Banking Institute. Before we get started, I'd like to give a special shout out to the sponsor of the Making Finance Work for Women podcast, Ernst & Young LLP. EY is a global leader working across assurance, consulting, law, strategy, tax, and transactions. EY teams ask better questions to find new answers for the complex issues facing our world today. Visit their website at ey.com to explore their latest insights and services. Now let's jump into the show. Now today we're going to be talking about women's health. Health is a personal topic for literally all of us. And I'd like to ask you, our listener, a few questions as a starting point to bring us into the mindset of this conversation. What if your ability to open a bank account determined whether you or your partner could survive childbirth? Meaning, if you didn't have a digital ID in order to open a bank account, you wouldn't be able to store money there. And then you wouldn't have money available when you need it for something like a health complication during childbirth. Or what if a lack of credit meant you couldn't access life-saving health care? Or if someone you knew or you even had no option but to save up money for months before booking an appointment after finding a lump on your breast? Financial systems and public health might seem like very separate worlds, but in fact, from our experience, from us as users, we know they're deeply intertwined, especially for women. Globally, women face unique health challenges that are often exacerbated by financial barriers. Things like maternal health complications, limited access to reproductive health care, higher burden of chronic diseases are just a few examples. These health needs extend beyond general medical care. They require specialized services that increase out-of-pocket expenses. Ensuring affordable and accessible healthcare financing solutions is essential to meet these unique lifelong needs. Let's look at the numbers. UNDP's latest Landscape of Microinsurance report tells us that while the market grew in 2022, which was great news, almost 9 out of 10 people in low-income communities still lack the formal safety net provided by insurance, and they risk falling back into poverty with any unexpected shock. And about a third of women in emerging markets say that their most worrying financial issue is coming up with money to pay for unexpected health issues or illness. In Nigeria, where the insurance penetration rate is less than 1%, 2/3 of women report being very worried about money to pay for health issues. Let's talk for a second about chronic versus acute conditions. Now, where I live in the United States, 86% of healthcare costs are attributable to chronic diseases, and this is from the National Institute of Health. Women's longer life expectancy and other factors increase their likelihood of having chronic conditions compared to their male counterparts, Men are more susceptible to acute health conditions like heart attacks that are over quickly and not as expensive. I don't mean to sound callous when I say that, but we are talking about money here. Now, unsurprisingly, when we look at reproductive health costs, childbirth is the number one reason that people go to the hospital if they're under 65 years old. And on average, in the United States, where I live, childbirth costs $19,000. And on average, $3,000 of that is not covered by insurance. Now, here's why finance matters to women's health. Finance plays a really critical role in women's health because financial constraints can hinder women from accessing care, leading to financial stress or delayed treatment. And this is a dangerous cycle. Stress about covering medical costs can create additional health challenges. The gap in health insurance around the world and coverage underscores the need for complementary financial solutions. Women often depend on liquid financial assets like cash savings or selling or pawning gold jewelry or informal borrowing to manage healthcare costs around the world. And expanding access to structured financial solutions like digital health financing could help bridge this gap. I always like to bring our conversation back to the story of an individual woman. And I want to share the story of Marissa, a woman that we talked to in Indonesia in the last few months. Now, Marissa is a 25-year-old informal worker in Indonesia. She runs a small food business and an online perfume business from home. She's a mother of she's a mother of a 4-year-old, and she's currently 5 months pregnant. Now, despite her entrepreneurship, her irregular income and out-of-pocket healthcare costs create a financial strain for her. Marissa relies on payments from BPJS, which is the government social security system for health and financial protection. It covers basic medical care and some surgery. She relies on those payments to cover her health costs, but for that, she pays a monthly premium for her family. Not all of the medical needs she has are covered, forcing her to pay significant out-of-pocket expenses when things go wrong, since she can't afford additional private insurance. Now, Marissa was diagnosed with a urinary tract infection during her pregnancy, and she had to buy medications out of pocket because the insurance, BPJS, didn't cover those medications. She also paid for her own ultrasounds and pregnancy supplements because of those insurance coverage limitations. Now, her story highlights the challenges that are faced by informal workers in accessing affordable and continuous healthcare. In Indonesia, the average cost for women-led households for private hospital care is 112% of their monthly non-food expenses. That's stunning. Let me say that again. In Indonesia, the average cost for women-led households for private hospital care is 112% of their monthly non-food expenses. It's just a huge increase if they need hospital care. Our guest today is Dr. Mary-Ann Etiebet, a recognized leader in global health and health equity. She currently serves as the president and CEO of Vital Strategies, a public health organization that works with governments and partners across 80 countries to ensure that everyone everywhere is protected by equitable and effective public health systems. Previously, Dr. Etiebet directed Merck for Mothers that expanded access to quality maternal health care for more than 50 million women across 70 countries. Later, as Merck's Associate Vice President of Health Equity, she led the development of the company's health equity strategy and advanced partnerships to improve healthcare access for underserved communities. Dr. Etiebet's career began in academia and public health and infectious disease, including her work with HIV/AIDS programs in Nigeria, impacting over 70,000 people. She's a Yale-trained MD and MBA, and she's board certified in internal medicine and infectious diseases. She actively serves on the boards of the Center for Global Development, in addition to her advisory roles with major global health organizations. Welcome, Mary-Ann.
Thank you so much, Sonia, and really thank you for the invitation to speak with your audience today.
Mary-Ann, I hope it's okay that I call you by your first name. Can you tell me, what is your origin story? Like, if you were a superhero, what is your origin story that brought you to advocate for women in public health and healthcare systems?
Yeah. Thanks for the question, Chan. And of course, it's okay to call me Mary-Ann. I was born and brought up in Lagos, Nigeria. And if anyone has ever been to that city, traffic jams are a way of life. But in one day, I was sitting in a traffic jam, and one of the things I saw has stayed with me, to this day. And this happened probably, I was about 10 years old. I was being driven to school, and I saw, outside, on the meridian of the highway, a girl, probably 13 or 14. She was carrying a tray of fruit, on her head, selling the fruit. But what struck me about her was that she had what we called in the vernacular bow legs. Her legs had a skeletal abnormality due to rickets, which is a nutritional deficiency. And it looked so painful for her to walk. She had to swivel her hips, but she was still out there in the sun selling fruit despite this really painful, health condition. She was holding the hand of a boy who looked about 6 or 7, and he was wearing a school uniform. And even at that young age, that image struck me as so inherently unfair. Mm-hmm. And the juxtaposition of education, health, economic opportunity, and how that really does, set, you on a pathway to being able to live your fullest life, or being able to only live a diminished life. And that really set me, I think, on my professional journey. I focused on health, as a place that I thought, I could address these issues and contribute, to changing that picture. But I've always been very cognizant that health is not something that exists in a vacuum, and that if you're really interested in improving health outcomes, you have to bring other sectors in, the finance sector, education, and thinking about broader economic growth and opportunity for the people you're hoping to serve.
It sounds like what you're talking about is like a systems thinking approach, which is why I imagine you're not like sitting in a hospital just solving individual healthcare cases. You're thinking about bigger picture financial systems, education systems, alongside of public health systems. Yeah. I wonder if you can talk a little bit more about that. Like, how does a lack of what we at Women's World Banking swim in every day, financial access to loans, savings, insurance payments, how does that lack translate into complicated health situations for women, especially in like maternal health?
Yeah. And Sonia, you're exactly right. I trained as an HIV physician, and so many times in that examining room with my patient, I realized, so many of the things that would actually best help their health were happening outside of what I could offer them. And thus, again, informed my journey, outside of the exam room to focus more on health system strengthening, whether that was through a funder's hat or an implementing hat, or a public health organization like I am now at Vital Strategies. Everyone's heard the 80-20 rule. There's an 80-20 rule in healthcare as well, where 80% of your health, 80% of your healthcare outcomes are actually driven by things outside of the health sector. Whether it's those are called the social determinants of health. They are the conditions in which people are born, in which they live in which they go to school, in which they go to work. And that those, drive 80% of healthcare outcomes. And so I always like to talk about and pull in other sectors, as we're thinking about healthcare outcomes. I mean, a huge determinant is, poverty and socioeconomic status. And so it's so exciting to see the work that, Women World Banking is doing to improve financial inclusion, for women especially. Because without financial inclusion, women aren't able to access healthcare. Or if they are accessing it, it's not high quality care. And that doesn't just mean, they may not live their healthiest life. In so many cases, that can actually be a death sentence. Financial inclusion is a prerequisite, for survival in so many of our communities.
That's really powerful. On a more personal note, you're a doctor and I'm a doctor, but I'm a doctor of international relations, and my kids kind of make fun of me because they're like, Mom, you're not a real doctor. And what they mean by that is like, Mom, you're not doing important things. But now I can think to myself, like, if without financial inclusion, women are not able to access healthcare. And you talked about how it's unfair. Yeah. And so thank you for
I'm always happy to be part of the, kind of the mom champion brigade. And before I, give you, a kind of stunning example of, one of these impacts, even though I am a doctor, my kids don't trust my medical advice and would rather go to the internet and say, this is what the internet says. So
that's so great.
It's our kids always challenge us.
They keep us humble. It's a universal challenge.
Exactly.
I wonder if you can give a concrete example of what financial barriers you see repeatedly preventing women from accessing life-saving maternal care, and what solutions might prove effective in bridging this gap.
Yeah. So I think, there are a couple of things. In so many low and middle income communities, cash has been king. And unfortunately, people need to pay for services before they receive services. And so even knowing that prevents so many women from seeking care during pregnancy, for seeking, from going to the hospital when they're about to deliver, because they know they don't have the money, to pay for those services. And that leads to death. There are a woman dying every 2 minutes due to preventable complications during pregnancy and childbirth. And these could be fully prevented if women were seeking care at the appropriate time. One of the things financial inclusion can help with is to provide women with the means, through which, they can pay for services either before they're seeking them, or even after. I'll give you just a very stunning example. When I was working in Nigeria on one of the HIV/AIDS programs there, suddenly one day at home, heard shouting, outside on the street. One of the neighbors' nannies was having an asthma attack, a very bad asthma attack. By the time I responded to the shouting and saw her, she was turning blue. She, was kind of incoherent. She had paradoxical breathing, and she was pregnant. Luckily, there was a hospital down the street. It was a private clinic. We rushed her to it. And the first thing the registrar said to us is, where's the patient's registration card? She has to pay. Of course, I got incensed and, made a lot of noise. But I actually, before they would see her, they required payment. At that time, cash was still the predominant mode of, exchange, in the country. But luckily I had a card on me and, they were able to process, the debit card, payment, and they saw her. But if, one, I wasn't there, and if two, I didn't have a card on me, one of, kind of a key vehicle of financial inclusion, she would have died. And there are so many stories like her that happen, every day, across, so many of these countries, where women are dying unnecessary from preventable, deaths. The other example I would give, and this is, a more positive example around, there are things we can do systematically to prevent this. One of the partnerships we were able to catalyze during my time at Merck for Mothers was a partnership that built a digital financial inclusion platform on MTBA. And those of you who, have been to Kenya know that, mobile money is a very common form of, financial exchange there.
And even more than like a bank account.
Even more people use it to buy bananas on the street, and so we were able to put on top of this mobile money system that people were accessing on their phones, and not smartphones, dumb phones as well, a care package for what would be the recommended range of services women would get during pregnancy, during delivery, and for postpartum care. And for all of those women, they were able to go to quality assured clinics and receive that care and have their payments covered through this mobile wallet that linked payments from the National Health Insurance System, linked funding from National Health Insurance payments, linked funding from if they had employer insurance, linked funding from philanthropy. And one of the things we were working on was whether it could actually link funding from remittances. And many of you, your audience may know that remittances are actually one of the largest financial flows that are supporting, healthcare costs, in low and middle income countries to the tune of billions. And if we can unlock, those financial flows through better financial inclusion instruments, we would really be able to go far in removing financial access barriers for high quality healthcare.
That last point is so interesting too, because for emergencies, people go to their social network. They don't go to their social network to say, I've got a great business opportunity. Well, maybe some people do, but most people go to their social network when they say, like, my son is in the hospital and I can't afford to keep him there. Can you help me? And so that remittances piece is so important. There was a study in Kenya that showed that when M-Pesa came on board in Kenya, or like when M-Pesa was started in about 2011, social capital actually went up. Like people started supporting one another more because all of a sudden they could. And so that's a great demonstration. Yeah. You mentioned like 4 other things.
And if I could say something, Sonia, I wouldn't actually say it's people were supporting each other more. It's now that we brought the informal out of the woodwork into the formal, communities, market women, this support has already been happening, but financial inclusion allows it to happen more efficiently with less friction and quicker. Again, there are too many stories I have where, yes, families have reached out, to look for money and support in emergencies. And by the time they're able to get it, it's too late, and so again, I am really applaud and deeply appreciative of the work that you're doing, especially the linkage between financial inclusion and digital inclusion, because it's making a difference, not just in the emergency, but in broader health-seeking behavior for people to stay healthy.
The story you shared towards the beginning of answering this question too was so powerful. The woman that you encountered personally and were able to pay for, but there isn't a Mary-Ann next to every person who's having a health emergency. And this point about cash, I think, is so critical, because there was a study by MicroSave Consulting about a decade ago that found that 22 to 26% of money that's stored in cash gets lost every year, compared to money that you put in an account. So like, it's not even just the availability. It's the fact that you're not losing cash because it's just sitting around and might be stolen or
burnt if your house catches fire. Your mattress catches fire.
Totally. And then of course the insurance piece. I wish everybody had adequate insurance to cover their health care expenses or their health needs. But we have to talk about these other things because insurance can't cover everything. Just like the model doesn't work to cover everything. And so we have to be talking about savings and payment plans and remittances and those kinds of other things.
Yeah.
I'd love to shift to talking about older women. I shared at the beginning the fact that women tend to live longer than men. And one thing I'm really thinking about myself as I'm aging and watching my parents age is health support for older women. And my mom listens to this podcast. So hi, Mom. I'm talking about you. This question's for you. Now, in nearly all of Women's World Banking's priority markets, the proportion of women over 65 is expected to double by 2050. It's an issue I'm paying attention to. I wonder, from your perspective, what are the blind spots we need to be paying attention to as women age, and how can financial systems support women in this?
Yeah. So I'm so glad you brought up that question, and I actually want to bring it back to the beginning because it really is a question about life course and making sure that we're able to address the full continuum of needs of women, across their life course. One of the questions you asked earlier was around what is the relationship between financial inclusion and public health, and we've talked about how financial inclusion is critical for health. I want to take a step back and also share that public health and investment in public health infrastructure is critical for financial inclusion. And by that, I mean, we will not make sure we're including everyone in these financial products unless we are counting everybody and unless we can find everybody and unless we can reach everybody. We can't stand on a corner and sign people up, or sign people up who have a bank account, or sign people up who have graduated from school. But the one thing we can do that makes sure we're signing every woman up is signing them up when they are born. And one of the important things that public health does through its work on civil registration and vital statistics is making sure every birth is registered and in the system. And once that's done, that means everybody has a legal identity. And through that legal identity, that unlocks, a lifetime of rights, of benefits, of services, including health services. And so it's so important that we count everyone. It's great that, Vital Strategies has been working with so many different governments, not just to improve their vital statistics and civil registration systems. Unfortunately, we are still at a place in the world where almost half of women, are not registered and don't have a legal identity. And, that's something we're working with governments, to change. But
Half of all women in the world are not
almost half. It's 45%. Yes.
Wow.
So do not have a legal identity. So they're invisible, and the other thing that this work that we do around, the civil registration and vital statistics, when we register every woman, we're able to understand, because now they're in the system, and especially if these systems are digitized, we're able to understand what their health needs are. And governments, or, you mentioned health insurance plans, would be able to allocate resources, based on the predominant health needs. So often, we have just not asked the question about what women's health needs are, especially, women, for the second half of their lives. We have no idea. And when you actually start tracking this, you realize that, women are dying of cardiovascular disease, they're dying of cancer, they're dying of autoimmune diseases, so many conditions that, haven't really been integrated in policy determinations, haven't been integrated in planning and resource allocation determinations. So I just wanted to make the point that public health infrastructure is also really critical to the financial inclusion goal. And back to your question about your mom, because we always need to make sure we're answering questions for our moms, is, I think when you have, these financial inclusion instruments, we know that women live longer, and unfortunately, they also live more time in poor health. Again, these instruments allow them to save money to be able to access care. Hopefully, these instruments, in many places, even though the household may have money, women are not in control of how that's spent. So there's independence, around deciding how money is spent, based because, you are in control and have agency of the money in that financial instrument. I think the other thing that's really important when we think about, care towards the end of life is also thinking about, who's there to provide that care. And one of the things, healthcare workforce, over 80% of the healthcare workforce are women. And again, in so many of these communities, it's informal. It's in the shadows, and we're not really capturing the contributions of women that they are making and the value that they are adding to the healthcare sector. But again, with these financial instruments, they're able to grow their businesses, whether it's being a midwife or a community health worker or a traditional birth attendant. They are able to share information, with their patients, and send information to their patients again, across these channels. They're able to keep an eye, out on the elderly, and make sure that they're not at risk for falls and, other things that, may really impact their quality of life. And so, again, really glad that you are making the connection between financial inclusion and health, because it's just so interconnected and interdependent.
And now a word from our sponsor. EY applauds Women's World Banking's 45-year legacy empowering women through financial inclusion. Together, we have a common vision to build a better financial services industry, one that is stronger, fairer, and more sustainable. Find out more on ey.com.
These are such good points, because I started this conversation saying basically that financial inclusion is an enabler of health. You've really turned that around for me and saying, sure, yes, for sure, it is an enabler, but also healthcare is an enabler of financial inclusion. You mentioned being registered at birth, and now you've also mentioned women as caretakers, women at providing health services and needing to get paid in reliable ways as well. And there's some great studies about Ebola a number of years ago that you may have seen, I'm sure, that showed that women were getting paid. The women who were taking care of people suffering from Ebola were getting paid in cash. And when they switched to paying people digitally, it really opened up lots of possibilities. People were able to stay where they were, not endanger their families by bringing cash home. And it made a big difference. But this point that healthcare is an enabler of financial inclusion, I think is a really important one for us to keep in mind. And it goes back to what you said at the beginning, which was about the interconnectedness of these systems. I want to ask a question about that interconnectedness, because I think sometimes when we talk about systems thinking, it's easy to say everybody's responsible and therefore no one's responsible. It's hard to keep people accountable to, and stakeholders accountable to, what they need to be doing to improve things. So I wonder about that accountability piece. If you could comment on who's responsible for each different piece, and how do we hold them together?
And unfortunately, when everybody's responsible, nobody thinks that they're accountable. And sometimes that is the dilemma we get into. I come from the premise that we are all responsible and we are all accountable. I think what's helpful in talking about these types of dilemmas is being able to be very clear about what each individual or each organization or each sector can do, to advance the issue, and being very concrete about it. Also being able to communicate back to the sectors, the individuals, the organizations, that their contributions have had an impact. And so being able to track the impact of contributions, outside of what they would normally do. And I think that's sometimes where we fall short, because I think everybody wants to know that, what they've done is actually having an impact. And when we don't share that information back, it shouldn't be a surprise that sometimes, we lose that buy-in and we lose that engagement. I think, specifically, for this question, I do believe it is the role of government, to ensure that everybody has a legal identity, and so that really important work of making sure everybody's registered and once they're registered, they have now access to immunizations. And if, for whatever reason, a family is not able to bring back, a child to get immunized, we can do outreach. They now have access, to education. I think that, another important sector, because, a lot of this, we talked about how digital becomes a real enabler and an accelerant, of financial inclusion. So I do think, the folks that are responsible for, telecommunications and telecom and some of the private sector partners in that space, that there's a lot, that they can be doing, around this. I think policymakers and government also have a role for supporting regulation and legislation that removes barriers, for all of this interconnectivity to happen. From a healthcare sector, I do think that they should be embracing innovation, and making sure that they're taking advantage, of these instruments and embedding them in, how they are thinking about providing care, and how they're thinking about payments, for care. So, being open to partnerships. And I think for philanthropy has a huge role to play in helping to catalyze collaboration and coordination, because that's often a cost that is hard for individual organizations to immediately see, what the quote unquote return on investment is. And so I think that's a perfect role, for philanthropy. Again, it's everybody's responsibility. We need to hold all of ourselves accountable for it, but we need to do the work, to catalyze the connectivity channels, between the sectors, and also to provide feedback, on the impact and results, of these types of collaborations and partnerships.
What strikes me about the different stakeholders you mentioned and the different actions you mentioned is, for many of them, there is a business case. Like for healthcare providers, like there is a business case to providing healthcare.
They get paid, more quickly, and there's probably more probability that they're not defaults.
And then for the financial sector, providing a variety of financial services offers opportunity to cross-sell as well. Like to say, oh, you have an account, you could also have insurance. I see in your account that you have enough money to be paying a little bit for hospital cash insurance monthly that just provides you a little bit to support if you need to stay overnight in the hospital. And those things, this isn't charity that we're talking about. It is true that government needs to step in where the market is failing, and philanthropy is so important to creating those partnerships. And we need those stakeholders. But for a lot of it, there is a business case to solving these challenges.
And I think the other thing that was very exciting for us when we were doing some of this work is the opportunity to leverage efforts. Not only are we making the pie bigger, we are also reducing the cost of implementing some of these things. And I'll give you, an example. We partnered with actually a startup, called My MDoc. This is in Nigeria. Again, a digital platform that supported healthcare coaching, and healthcare coordination for pregnant women, also for chronic disease. The same way that they onboarded, women onto this, digital platform for health. They piggybacked it with, supporting financial literacy and digital literacy and not just health literacy, so in that one conversation, you're actually supporting a woman to be able to better understand, financial literacy, digital literacy, health literacy, so that they can actually access the services and utilize them and optimize their utilization of them. And it's one conversation, not three.
That's great. It's better for her too, because she's not logging into 3 different platforms for all of that really useful information. I want to end with one question about that gives you the power to change things. If you had the power to redesign financial systems with women's health in mind, what's the first major change that you would make? And what can I work on then as a result?
I think the first thing, as I mentioned, is fundamental. We have to make sure we are counting everybody. So going back to basics and making sure that the birth registration work, is happening, and 45% of women are not left in the shadows without a legal identity. Doing that, in a way that is digitized, so we can layer on, all of these different types of services onto that platform. And for me, again, back to your question around systems, when we fix the systems, they can work for multiple use cases, for multiple needs. And I think for me, it's about starting at the beginning, when women are born, making sure we're counting them, making sure that they're included, and making sure that these systems are interoperable. So whatever needs, any one individual woman has, whether it's a health need or a finance need or an education need or a need for her family, that can be met, in a accelerated, real-time, digitized way.
And back to basics is a great note to end on, a good reminder to us that it doesn't have to be super complicated in order to be impactful. Thank you so much, Mary-Ann, for joining us.
Yeah, thank you so much for the invitation and for all the work you're doing.
Well, I hope you all enjoyed that conversation with Dr. Etiebet. I really enjoyed it. I have a lot of notes, and I often like to read out my notes so that we can compare notes together. One is she talked about a lack of healthcare just being unfair, and that revelation being something that drove her future work in this space. I love that. She also talked about finance being an enabler of women accessing healthcare. And that's a fundamental reality that we started our conversation with. But she turned it around for us and said, healthcare is also an enabler of finance. We talk about people being born in hospitals. They can have a birth certificate and registration that says who they are, that creates financial opportunities for them later in life. She talked about the healthcare workforce. 84% of the healthcare workforce is women. And so we're talking about women having health challenges, yes, but we're also talking about women as caretakers and women as solutions, which I think is an important thing to remember. Like, women aren't just the problem. They're not victims. They are the solution as well. And then finally, talked about innovation, the role of innovation, and how both health providers and financial services institutions can be innovators in the space, which is tremendously important. So thank you so much for joining me for that, and for hopefully having your own notes too. Just a couple notes here at the end from our team. Now, women's financial sector participation is truly at the center of the fight for resilience in the face of crisis. It's health and it's beyond health. We know that when women have access to the right financial tools, whether it's savings or credit or insurance, they're not just building wealth, They're securing better health outcomes, they're strengthening their families, and they're creating more resilient communities. But to drive real change, we must recognize that financial systems and public health and education and registration and ID systems and all of these things we talked about today are deeply interconnected. So let's move beyond the bank and start seeing financial inclusion as a life-saving tool for women everywhere. Me as a doctor, but not a medical doctor, I'm still doing really important work for women's lives. And I really feel that today more than I have before. Please join this conversation. You can share this episode with someone. You can help push for solutions that empower women to thrive and not just survive, exactly where you are in your role and in your context. Now, if you found today's discussion valuable, please don't forget to hit the subscribe button, to rate us, to share us with your friends or colleagues, and to leave a review on your favorite podcast platform. I mentioned my mom is a listener, and I'm going to have her leave a review this week, so you can look for that. Your feedback really matters to us, and it helps us bring you content that resonates. So please stay engaged, stay informed, and I cannot wait to see where the rest of 2025 brings our conversations. Thanks.